All right, good morning, everybody. We are going to go ahead and get this committee hearing started. I know we're all lamenting another Patriots Super Bowl victory and probably experiencing a little bit of a fog this morning as a result, some of us, but
Mr. Brady's cousin is not concerned.
that's right, that's right. But I want to welcome back my colleague Craig Rice from his very important and very informative trip to Africa. And Councilmember Rice, as I shared on my first day, which unfortunately happened to coincide with a look at a mid-year savings plan, that I am very much looking forward to serving with you, sir. I've admired you for quite some time. I know how passionate you are about the matters that we discuss in this committee and what a leader you have been. You have a rock star team, and along with my colleague Evan Glass, who I have a great deal of admiration for as well, I think this is going to be a powerhouse crew. So look forward to serving with you, and want to welcome my colleague Sydney Katz, who is our chair of our Public Safety Committee, who will be joining us for the first item on the agenda today. And with that, why don't we get started and walk through the packet. The first item is discussing Bill 3518, the Health and Sanitation Smoking Outdoor Serving Areas Resolution. And today we will be discussing the committee's formal opinion on that matter. And if maybe you want to walk us through the packet, that would be terrific.
Sure. I'll just note that the first page of your packet deals with some very superficial comments about the background on the health concerns of cigarettes and electronic cigarettes. And the reason that is not as in great detail as usual is because the committee has talked about this many times, and so I've linked to a couple of packets where folks can go on and instead of putting it specifically in this packet, we just have it there as referenced, and so just incorporating all of those health concerns. The council held a public hearing on Bill 3518 on October 23rd, and you heard from folks both supportive and in opposition to the bill, and several groups or individuals suggested some amendments to the bill, and so I'll walk, unless you have some opening questions, I'll go ahead and just walk through the amendments that had been proposed. The first is the Greater Bethesda Chamber of Commerce proposed a grandfathering amendment that would allow smoking in outdoor serving areas of eating and drinking establishments that have alcoholic beverage licenses. And similarly, the owner of Tommy Joe's requested an amendment to grandfather existing establishments or have what they called an upper level open air exemption, rooftops and balconies. The council staff recommendation was that we didn't support the grandfathering portion of that, but the Councilmember Rice has an amendment that's in the packet that he intends to offer that would allow an establishment to designate a portion of an outdoor serving area on a rooftop or balcony where smoking or vaping is prohibited after 9. Over the weekend, we got another letter from the Chamber of Commerce that requested an amendment to that amendment to remove the time restriction.
Thank you for that overview. Councilmember Katz, as the sponsor of this bill, would you like to make some opening comments? And I know that my colleague, Councilmember Glass, and I are new to this issue, but certainly have both been doing our due diligence over the last several weeks. But if you'd like to make some opening comments, that would be great.
Well, thank you, Mr. Chair, and thank you, and welcome back to Craig, though we've seen him a couple days since. So, but my preference, obviously, when we first decided to propose this legislation, we had discussions with the restaurant industry, we had discussions with the chambers, we had discussions with people who were the advocates of it and people who didn't think it was the greatest idea ever. We knew it was going to cause some discussion. But currently, this is the law as it exists in Rockville and in Gaithersburg. They do not allow smoking in the outdoor serving areas of the restaurants in those two municipalities. We met with them as well. When we first proposed this, I mean, if I had my druthers, I would rather see it as written, but I understand, and we said in the very beginning that we would certainly consider amendments. That's what a public hearing process is about, and that's why you hear from the public. I do know about the idea for the smoking in the rooftops. I can understand that, and I know that there's people that say it should be, if you're at the rooftop, it shouldn't just be after 9 p.m., it should be at the rooftop. I am concerned about the word balcony. I don't know, is there a definition of the word balcony? And if so, what is it? And does that mean a balcony can be literally off of the rest of the restaurant itself? If what I would think, a rooftop would be that it would not necessarily be off the restaurant. It would be above where people were serving. So, please.
There isn't any definition in this amendment for the word balcony. The reason that we drafted it in that manner was because, the first idea we had was just to say above ground level, but, I mean, you could put a small stage that was above ground level and still meet that. So it was intended to clearly get at like second story and above.
Well, and for that, there would have to be an enclosure from the rest of the restaurant, I would think. Otherwise, if someone could smoke in the balcony now, which would be allowed as it exists today, then that smoke would be carried forward into the rest of the restaurant as it exists today. So I would think there has to be some sort of an enclosure if we were going to do this.
Well, if the balcony is enclosed, then it would be you could not smoke there in any event because you cannot smoke in an enclosed area.
So if the balcony were open, so the rooftop would also have to be open. It wouldn't be an enclosed rooftop. So if the balcony, right now, can someone smoke on a balcony if it's enclosed only to the outside and not to the rest of the restaurant?
If it's an enclosed balcony, then you would not be able to smoke inside of it because, I mean, even state law prohibits smoking within 4 walls, roof, and a ceiling.
I guess I'm not asking this clearly. If there's no partition between if the balcony itself, if the wall of the balcony is the outer wall, then right now, and that balcony would be a part of the restaurant, the rest of the restaurant. They wouldn't be, I wouldn't think they would be allowed to smoke there now.
That's correct. If the outside wall includes the balcony, then it would be part of the restaurant. This is just basically if, the 4 walls are here and there's a balcony over here that is not enclosed.
So I guess my point would be that this wall of this balcony, if this were to go forward, would have to be the wall that's blocking the restaurant from the outside, and then they'd have to open up the area that goes to the street so that it wouldn't be totally enclosed.
Right, there would be a door leading to the balcony that people could, walk through, and the balcony would be open.
Right, okay. And then I also did propose for the, on golf courses, and it's, I guess it's on page 3, subsection C there, the exception, smoking or vaping is not prohibited on a golf course or in an outdoor seating area associated with a golf course if employees of the eating and drinking establishment do not serve food or drink in that area. And I think that certainly makes sense. So this was never when we were banning smoking. This was banning where someone would be served. So, but that's my concerns, and thank you for listening to me.
Thank you. Councilmember Rice, do you want to talk about your amendment and a little bit of the context and background?
Sure. Thank you, Mr. Chair. And thank you for the very kind words before. It's nice to be back in HHS. Let me just start off by saying that I co-sponsored this bill because I do believe, as a person who is not a smoker, as a person who understands the concerns about the risks of secondhand smoke, and also the concerns about what may or may not be included in vapor that emanates from vaping products. I get it and understand why people are concerned about it and want to see restrictions. I know that it causes concern. I know that it's caused concern in my own household to where family friend who came over decided to start vaping in my house and said, yeah, you got to take that outside. And so it's one of those where I certainly understand the angst for other people as they may be around these kind of products, but I also want to make sure that we're not infringing upon businesses and their ability to cater to those folks who do choose to still partake of these particular products. For me, it's more about the vaping than it is about the smoking. Secondhand smoke is very clear that we know causes cancer. It certainly has ill health effects on not just the surrounding environment, but also on the employees who have to be around it. So from that perspective, I certainly get and understand where we are when it comes to the smoking aspect. The vaping is still one where the jury's still out. We're still finding out more information, but did want to give some flexibility. And oftentimes, rooftop areas, open air areas are ones in which people who do still smoke or vape are seeking out those areas to be able to still partake in those kinds of practices. And so from that perspective, that's the reason why I wanted to try and strike a balance between what we're trying to do in terms of providing areas where folks can avoid. And I remember when we first had smoking and non-smoking sections, and that was a big deal for myself, for my family, for this community. And so, then banning smoking as a whole in restaurants and having folks outside. And it certainly is one where, even now in our county building, where very few, but you still have a few folks who smoke outside in the parking garage or in the area leading up. And then we've said, well, those areas still are areas where people walk through. And so it really is trying to find a mix, a good median point between the folks who continue to choose to smoke or vape and those folks who don't want to be subject to the clouds of either vaping or smoke that emanates from these products. So, this is the balance I tried to achieve. Talked with a number of the stakeholders as well. I certainly understand not wanting to have the restrictions for the time. I'm flexible at this point, Mr. Chair. It's about trying to get to 5 votes to move forward with a compromise piece of legislation. And so from that perspective, I leave it in the hands of you as the chair, sir.
Thank you, Councilmember Rice, and thank you, Councilmember Katz, and our previous council for your leadership on this issue. I know that you have worked hard to strike that balance of trying to ensure our public health and trying to ensure also that we don't disproportionately impact our small local businesses who, as we all know, struggle to make ends meet. And that's particularly true in our restaurant industry, where the profit margins are razor thin, and we have definitely felt the impacts of the rise of the nightlife in the District of Columbia and Northern Virginia. And I did have the opportunity to participate in the county's Nighttime Economy Task Force, as did my colleague, Councilmember Glass, and saw firsthand the research and due diligence that was done and the recommendations that were made to really do a better job of attracting a millennial population that is what our workforce is looking for, and that it adds to an element of competition. I want to thank the advocates, and in particular Mr. Zimmerman, who I had the opportunity to meet with recently and was very impressed by. I know that a lot of work and a lot of research has gone into public support of this particular bill, and as the husband of a wife who has asthma, and as the father of 4 children under the age of 10, I fully recognize the challenges that presents as we're walking through and unintentionally experience secondhand smoke. I also want to acknowledge that I did have the opportunity to meet with the owners of Tommy Joe's and Caddy's and was equally as impressed by their corporate responsibility and their impact in our community. I know that both of those places are destination establishments, and I want to thank the owners and proprietors, not just of those restaurants, but all our restaurants, for trying to enhance our quality of life in the county on so many different levels. And so where I stand on this particular issue is that I do believe that We have a unique situation here in that we have two restaurants exclusively within the CBD of Bethesda that have rooftops and balconies. There are no other restaurants with those same amenities. And in our research as an office, there are very few restaurants that have rooftops or balconies across the entire county. And so there would be a disproportionate impact of this particular legislation on those businesses. And for that reason, and for the reason of wanting to move the needle forward in our public's health interest, I do support the bill with the amendment presided by over Councilmember Rice, but don't support the 9 p.m. restriction because I do believe this weekend, notwithstanding as a good example, the Super Bowl started at 6 o'clock, and I suspect there were a number of people that arrived prior to 6 o'clock. And I also believe that because rooftops and balconies are more or less destination spots within restaurants, you don't have to pass through them in order to get to various elements of a restaurant, then there are more options to restrict their use and give the restaurant owners more flexibility. And for those people who would just as well not want to pass through the smoke or the vaping, they wouldn't have to because those are destination spots within restaurants that people could choose to avoid. And so for that reason, I support the bill and would like to be listed as a co-sponsor with the amendment and the elimination of the provision of the 9 p.m. I also appreciate staff research on this as well. That's currently where I stand. I want to turn it over to my colleague, Councilmember Glass, if you have any opening comments or anything you'd like to say as well.
Thank you, Mr. Chair. This is a really interesting issue and one that is deeply personal to me because as you alluded to, you and I both did serve on the Nighttime Economy Task Force, and while it seems like a long time ago, probably 5-6 years ago, the problem hasn't gone away that Montgomery County is still trying to attract young people. We have the largest percentage of seniors, and that isn't changing. And when we look at the DC region as a whole, as Councilmember Rice said, young people are not moving here. They are moving to Arlington, to the district, and to other locations. And I think the data point that you, Mr. Chair, referenced is an illuminating one. In downtown Bethesda, per se, they're, based on information I have, about 182 to 190 restaurants, and only a handful, 4 or so, have rooftops. And of them, at least 2 allow smoking. So what we're talking about is a really small number that currently allow this. And we haven't even engaged in the conversation regarding downtown Silver Spring, where 2 of the hottest places where young people go to are Caldi's and Society. Both have rooftops, both allow smoking. And they are probably undeniably the coolest, hippest places in downtown Silver Spring. That's why I don't go there, but I know, I've heard, I've seen on social media, I've seen the lines outside. And ultimately, the reality is that if this moves forward, I probably still won't go there because they'll allow smoking if this passes. And I'll choose to make my voice heard by reserving my dollars and not going there. And anyone who doesn't want to be in a smoking environment can choose not to go to those handful of establishments because there are hundreds of others that one can go to. And in thinking that through, it was particularly hard for me because smoking is something that has impacted my life. My mother passed away at the age of 53 because of lung cancer. And she was a single mom who raised me, working 2 jobs, and she was not a drug addict. She was not an alcoholic. She smoked, and she smoked 2 packs a day. And so I understand how hard this is for lots of families and lots of individuals. I don't smoke now, and I choose not to associate myself with establishments that allow it. And I'll say again, I will choose not to go to these handful of places, but I know a lot of other people do. And just like they can drink at those places, they can smoke there too. And I support the amendment to the amendment, the revised amendment allowing smoking at these rooftop facilities, knowing that it is very limited in number, the places where individuals can go to. And if they choose to do that, That's their prerogative as an adult, and I probably will wish them well and not go there. But as a general health issue, I think taking smoking off the streetscapes, so that as we walk down our main thoroughfares, we're not bombarded with this, and I think this strikes a fair compromise. So I will support this.
With the other amendment as well? With, yeah,
The other amendment,
being,
Golf course.
yeah, the golf courses.
yes.
Yeah.
Again, private establishments, and if a golf course chooses to do that, members can vote internally to change those regulations, or again, they can choose to make that decision with their wallet and choose to go to another golf course, another country club.
Thank you, Councilmember Glass. Councilmember Rice.
Well, thank you very much, Mr. Chair, and I just wanted to let you know that I certainly accept that as a friendly amendment, the elimination of the after 9 p.m. And so I just really want to thank all of my colleagues for their very thoughtful and heartfelt comments about this. This is not easy in striking a balance. Everybody has the personal pieces and touches of what this means to them, and I think that we are establishing and building upon great public policy that we already have here in Montgomery County. I mean, keep in mind, we already banned smoking in restaurants as a whole. I grew up here in the county when smoking was all around you in restaurants. I mean, that's what it used to be. So it's not that long ago. And even just having smoking and non-smoking sections is not that long ago. And Montgomery County has always been at the forefront when it comes to these kinds of issues. And keep in mind what we're doing, while people may think, well, you know, you're putting an open window, we're actually being more restrictive. We've added vaping that wasn't in this before to a list of prohibitions that we're doing. So we're being more restrictive, and certainly, I think, again, striking that balance. And so I just really want to say again, kudos to Montgomery County as a whole for continuing to always put public policy when it comes to the safety of our constituents, married with making sure that we understand our business community and the importance of our economy as a part of it as well. We do a great job of that, and so I think that, you know, this is, we should really be very proud of what we're about to do here. So, thank you, Mr. Chair.
Thank you, Councilmember Rice. So I think that, Ms. Myhill, we have a 3-0 committee-supported vote with the amendments as stated, both on the golf provision, but also, or the golf course provision, but also the 9 p.m. and balconies and rooftops.
Yeah, and I just wanted, just for clarity, I just wanted to make sure that your vote is both for the bill and the accompanying Board of Health regulation.
Yes.
Can I just ask about that? For the Board of Health, the currently Gaithersburg and Rockville do not allow in the rooftops. I don't know that they have. Well, I guess they have some balconies there. And is there a way that the Board of Health, because it would automatically go into the municipalities as well, is there a way to say that for the Board of Health that if a municipality has a more stringent part to what they're doing, that this would still be allowed?
So if you look on page circle 40, which is Councilmember Rice's amendment, there's actually there's a sentence there that says that the paragraph related to balconies and rooftops doesn't apply in a municipality that prohibits smoking or vaping in outdoor serving areas.
So
that's
so
within
that would
the
allow it.
amendment. So it will allow Rockville and Gaithersburg to continue to be stricter.
Good. Thank you, Councilmember Rice and the committee.
Great, thank you, Ms. Myhill. So that takes care of the first item on the agenda. And thank you to all the folks who came in the audience to address this important issue. Let's move on to a briefing on the Food Secure Montgomery, a 5-year strategic plan. And we invite Ms. Jackie DiCarlo, Ms. Heather Bruskin, and Mr. Dr. Travis Gales to the stage. Thank you so much for joining us today. We appreciate you guys taking time out of your very busy schedules. I know this is remarkably important work, and I am impressed by the three people who are before us, who I know and admire personally. So I guess, Dr. Gales, why don't you start us off, or whomever is in the best position to go through the presentation.
Sure, all right. Well, first and foremost, good morning, and thank you all for the opportunity to come before you. I think this is the first time where we've had the new subcommittee together, so I'm equally as excited to work with you all. And before we get started, wanted to just recognize all of the individuals who are at the table as well as in the audience who are contributing to the great work that is being done around the food security issue. Jackie and Heather, and then also in the audience we have Amanda, Deanna, Karen, and Thomas as well, and if there's others, forgive me, but this represents the collective team doing all of the work that we're going to talk about today. So I want to go through my pieces really briefly, and I'll give space to those folks to be able to comment in terms of the work that they're doing on the ground. So we'll move pretty expeditiously through this so that we can give them an opportunity to highlight and give some anecdotal background to what we're talking about. So just briefly, the food security plan was created, the strategic plan was introduced back in 2016 and pretty much and adopted in January of 2017 with the goal of coming up with a strategic plan to address food security in our county. Now, we have talked about before, and we'll talk about in the context of all of the public health issues within the county, is the fact that most people don't recognize that we are impacted by such things. The notion is that Montgomery County has infinite resources, so food security isn't an issue, public health isn't an issue. But the folks at the table and those throughout the community do recognize that, and again, continue to do great work to highlight those needs and pockets of needs within our community. So when we look at food security, again, compared to some other jurisdictions throughout the state and the nation, we don't have as high numbers, but we are still impacted by it. Particularly 7% of the county's population was estimated to be food insecure. And what was even more troubling was the fact that double that number percentage of children. It's most prominent in geographic areas: East County, Silver Spring, Wheaton, and Gaithersburg, and Germantown. Now, the shared vision that encapsulates the program, this is the mission statement here, but when we look at food security, the components of that are meaning access to safe, sufficient, and nutritious food in order to lead fulfilling lives. And it's not just a matter of there is a store on your corner, but what does the store actually sell, and what types of food does it sell? And how easy is it to get to that particular location in order to eat the right kinds of foods, to have the right kinds of outcomes, just at a baseline to make sure that folks aren't hungry. But even when hunger is taken care of, are they healthy options? And we'll talk about diabetes in the later half of the presentation when looking at health outcomes. But that is the goal of the program and the strategic plan. And part of, to get to that goal and shared mission, is really truly understanding what the root causes are of food security and the drivers in our county. We know that while we don't have as high numbers of poverty in comparison to other jurisdictions, and our unemployment rate is lower than a lot of places, we know that it's extremely expensive to live within the county. And the self-sufficiency numbers are high. And so even though we may not have as high of an unemployment rate, we do have a large amount of folks who are in jobs who don't make enough money to qualify to meet the self-sufficiency standards, and thereby are disproportionately impacted by issues such as food insecurity. All right. And moving forward, looking at some other areas, again, issues such as transportation, access to grocery stores that have healthy options, as well as, again, when you have a high percentage of folks working in the county, but again, so you're caught in a catch-22. You make too much money to qualify for benefits, but not enough money to really to meet the self-sufficiency standards. That creates another driver for food insecurity issues. And I know, coming from other jurisdictions, I was in Chicago for years, big urban area, so food deserts was a concept that was talked a lot about. And again, it's something that we think of in the context of major urban centers, but don't necessarily think about in the context of a suburban mixed place like we live in. But it is still a significant issue. And so this fits very nicely within the larger framework that we're taking in public health services and health and human services, and looking at how policies that we don't traditionally think of that impact health outcomes actually do. So this health in all policies framework. So for example, when you're looking at where grocery stores and food places are located, then you also have to think about, well, how easy is it to get there to access? So if I'm in this income donut area, so to speak, that we've talked about, do I need to get the bus? Do I need to get the train? Do I own a car? How do I get there to make sure that I can get the items that I need to have healthy outcomes for myself and for my family? And again, it's important to note that even when we break down those overall averages, there still are significant vulnerable populations that exist within our county where food insecurity disproportionately impacts children and seniors in particular. Councilmember Glass mentioned that we have a large amount of seniors within our population here, less so on the millennial side, but we know that seniors are significantly impacted by food security due to a host of issues. And we also know that we do have a large population of persons living with disabilities as well, where this is a significant concern. Now, to move quickly to some of the recommendations, again, this is a multi-year strategic plan. I know Heather is going to talk about some of the accomplishments from year one, as well as the strategic vision and list of hopeful activities for year two. But just wanted to briefly mention some of the accomplishments so far that have been achieved. The year one recommendations, data, which you're going to hear a lot about today, and moving forward in terms of our public health approach. So standardizing data collection and reporting so that we can get an accurate sense of what is the true impact of food insecurity in our communities. And so there was data standardized surveys and spreadsheets that have been used. That has contributed to being able to identify high priority zones so that, again, the interventions can be targeted to the communities that need it the most. And that was the creation and furtherance of the food stat tool that I'll talk about in a second. Increasing connectivity, collaboration, and information sharing. And here are a list of the action items that have helped to achieve those goals. Leveraging existing programs, particularly the expansion of the weekend bag program, continuation of the senior nutrition program, as well as continued support of projects through community agencies that promote food, fitness, and fun. And the last component is looking at new data sets to identify other populations. And one of them, for example, that came out of the first year report was a high, even though we don't have a ton of millennials in the county, we do have a high number of college students. And college students don't make a lot of money. And we don't historically think of them as being vulnerable and high need when it comes to food security. And the team has identified that need and has started a number of projects aimed at that group to address that particular concern. Now, just to highlight some of those accomplishments, again, the standardized data collecting and reporting spreadsheet. Here is just kind of a report of what was done. It's important to note that the goal, again, is to collect data, food assistance throughout the county and be able to upload that to the food stat tool. And then this information is distributed by email to non-grantee providers, as well as to grantees who receive funding from the county around this particular issue. Just to give some background into the very nifty and comprehensive food stat tool. The food stat tool was launched on May 1st of 2018, developed with the input of providers and community agencies throughout the county. It was developed to be flexible for multiple audiences, from the basic user trying to understand the global view of food security within the county, to the advanced user looking to program and collaborate with stakeholders to, again, do work within this particular issue. What it is a geospatial data discovery tool that allows providers to be able to explore where the issues are most severe, as well as where there are tools to address it and agencies that are working to provide resources to the community. Another component of it is a data repository tool that allows for the most up-to-date data around the issues. So if you as a council member have a concern to say where, at any point in time, where are we being disproportionately impacted by the issue. For example, recently we've had the federal shutdown and food security was a big concern. And so the goal of the food stat tool is to be able to track where need is as close to real time as possible. So again, we can be able to identify and disperse necessary resources to those particular areas. All right. And again, although this is a view of the dashboard, so although it's a first generation tool, there will be multiple refinements that go into figuring out how to make it more user friendly, and again, more responsive to real time data. There are 6 categories, which include administrative boundaries, institutions and community assets, food retail, assistance and assistance providers, transportation and access, and demographics. And all of the data within the food stat application will be updated to the most current and up-to-date version during the spring of 2019. And just to highlight some of the major updates that will be coming in the spring of 2019, the County Stat Office, in collaboration with HHS, is in the process of collecting data from the county's largest assistance providers. The data set will act as a 2-year baseline that will supplement the newly implemented grants reporting process that will be mentioned in further detail in the next slide. This baseline will allow for the department and stakeholders to make better, more informed decisions about how grants can be allocated, again, once using data once again to be able to highlight the agencies and pockets that need the most assistance. And the newly created data will provide the stakeholders with new insights for improving education and outreach, allow for the department and service provider specific areas to enhance the focus of capacity building and distribution within their areas. Again, we recognize that food security is not something that just stands alone in public health. It's something that reaches across all of the different agencies of HHS, as well as across other intergovernmental agencies as well. And the goal with this tool is to be able to highlight those needs and be a part of those conversations. And again, this also shows, again, some information about our weekend bag program. There will be new data published from the weekend bag program released in early spring that will help guide the future discussions with MCPS as to which schools may be the best candidates for the weekend bag program. Again, trying to identify where the need is greatest and stepping up to the plate and addressing them by expanding the program. Again, as we talked about in terms of one of our vulnerable populations, we know that children under 5 are significantly impacted when they are struggling and dealing with food insecurity. There were 9 listening sessions across the county to get a sense of what the magnitude of the problem has been and is within our community. And basically, the report of all of those findings will be coming out within the next several weeks to talk about, again, what the magnitude of that issue is within the community and the impact to, again, help guide policy conversations around how to address food security for children under 5. And to set the stage for the next presentation and further comments, here are just some of the increased food access risk for residents with mental health disabilities. We know that isolation is a big issue and concern in the county, and so making sure that folks who are living alone are connected. So one, that there is someone who understands their particular needs and they're in constant communication, and there is the opportunity to link them to the resources to help them have healthy outcomes. And the recommendations for year 2 and 3 are listed here. Again, Heather, I won't still the thunder from Heather. She'll talk more in detail about these. But again, this is a multi-year process that is fluid and building upon the pre-existing work to take things to the next level to address these particular concerns. One last thing that I want to highlight is the Community Mini Grant Program. We do have Community Food Rescue Capacity Building Mini Grants. That's the official name. There were $30,000 worth of small grants that were set aside from DHHS and administered by Community Food Rescue. The grants ranged in amount from $600 to $5,000 per grantee. And during the first year of the program, 18 organizations received funds from that source. They were asked to use FoodStat to justify the need. Again, this shows how we're using data to drive those conversations. And the goal is to, again, use this data to inform best practices around the particular issue, to, again, help meet the need in the immediate sense, but also look at how we can understand the best practices around food security within the county and scale those up to larger projects. And again, the purpose is that when we come to you and asking for more resources for larger issues, we've got great data and pilot information to be able to show the impact, how those best practices have done to justify the need for expansion and scaling up.
Well, good morning. My name is Heather Bruskin, and I'm the Executive Director of the Montgomery County Food Council. Thank you, Mr. Chair, and the entire HHS committee for the opportunity to speak today, and also for your leadership on this issue. The Food Council is very grateful for the opportunity to be HHS's key community partner in first the creation and now the implementation of the Food Security Plan. And the Food Council is an independent nonprofit that serves as the central connection point for community stakeholders who share a commitment to cultivating a robust, sustainable, and equitable local food system. So we pursue our mission through a variety of strategies, including increasing capacity of local programs, businesses, and organizations, growing and strengthening networks and partnerships, leading advocacy and driving policy change, building community knowledge and awareness of programs and resources and issues, and researching and communicating opportunities and challenges within our local food system. So while we only have a staff of 4 permanent employees, we also bring 25 system experts to the work as Food Council members, as well as over 200 community partners in our 4 monthly working groups and other initiatives to drive these initiatives. So as Dr. Gales already shared, the years 2-3 recommendations for the food security plan are extensive and focus on increasing capacity of local food resources. So in addition to serving as a partner in the programs that have already been outlined today, the Food Council leads many additional community initiatives and plan implementation strategies, ensuring as many county businesses, nonprofits, residents, and government agencies are engaged in the effort and leveraging as many resources as possible to support its success. So the plan's first year recommendations were centered around deepening our understanding of food insecurity in the county, as well as resources available to address it. So in year 1, we created the first comprehensive list of over 75 food assistance providers, and these ranged from large providers like Manna Food Center and the Capital Area Food Bank to small community-based food pantries and meal programs. And the Food Assistance Resource Directory lists the hours open, services provided, and detailed service information, including do they have walk-in services and accommodations for special diets. It also provides information on locations for benefits application assistance and senior congregate meal sites. It's been distributed widely, translated into Spanish with over 3,000 copies in the print version already shared, and it's also been featured on the MCPS school lunch menus, in 311 referrals, and in healthcare settings and job centers. And we just completed a full update of the information, including multiple new providers added, and we've worked with County Stat to update the print map that's featured, and I think you have a copy of it shared with you today. And just last week, I'm excited to share that we announced and released an interactive searchable directory of this data to more effectively communicate the information and share it more widely. So So once we've identified the location and scope of the existing food assistance providers, it was important to also understand what they need to more effectively serve local residents. And so the Food Council administered a training, connectivity, and resources survey in 2017 to collect information from the providers on their training needs, potential for increasing capacity, and also their barriers to doing so, the availability and sources of culturally appropriate foods, and the needs for more cohesive provider-to-provider network and information sharing platforms. So, guided by the responses to that survey, the Food Council built on our existing food recovery and access working group to create a community of practice of over 35 direct food assistance providers and 35 additional local partners that are engaged in food security work. And this working group builds a network, facilitates collaboration, and serves as an effective mechanism for sharing best practices and other resources. And most recently, the response to the shutdown and the food access challenges that posed, it was critical to have this network in place so that we could have quick sharing of resources and mobilization of services that were needed. So the Food Council, in partnership with county government and nonprofit agencies, has created a wide range of resources to enhance the capacity and effectiveness of existing programs. So we have an online provider toolkit, which provides training webinars on how to help clients fill out and submit SNAP application forms, as well as how to use FoodStat to be more strategic in service planning and in delivery. The working group also serves as a resource to new and prospective county grantees, including the Community Food Rescue mini grant recipients, which were mentioned earlier, enabling many small providers to get connected into this network and become more aware of available resources and funding opportunities so they can enhance and expand their services. Another key component of food security is access to foods that are familiar, both for consuming and for preparation. And so our working group is developing informational resources with the goal of increasing access to culturally appropriate food. The Food Council paired with the team from American University to research this issue, and that resulted in a gap analysis report as well as specific recommendations, and that's available on our website. And we have a new subgroup that's being convened to explore the issue in greater depth and to move forward on implementing those recommendations. So you may already be aware, but Montgomery County is one of the lowest participation rates in Maryland among eligible residents for benefit programs like SNAP. And so to increase use of these valuable resources, a collaborative senior hunger and SNAP outreach program has been created to leverage dozens of resident volunteers to provide trusted, consistent support, both navigating the application process and sharing reliable information about minimum benefits and eligibility requirements. And this is particularly important in a climate of fear among immigrant families about participating in these programs. Just this month, 27 volunteers will engage in community outreach at Montgomery College, at Gaithersburg Senior Center, and at a MCPS pre-K Head Start event. So engagement of the community has been a critical strategy in creating the food security plan, and it's equally important in its implementation. In addition to our regular convening of stakeholders and our council meetings and our working group meetings, we regularly build awareness of the food security plan in the community and across sectors. It's essential that the lived experience of food insecurity directly informs our implementation strategies, and to ensure that we're intentionally doing so, the Food Council has been awarded an AmeriCorps Vista to regularly convene a community advisory board of county residents who have experienced food insecurity. And our first meeting is tomorrow, so it's a good way to start. The Food Council also conducts extensive research and outreach in our county and in our region to increase the visibility of food insecurity as a significant issue affecting our county's residents, and to highlight our extensive and innovative strategies to address hunger and to increase food access. We led or participated in over 110 meetings and 30 conferences in 2018, including a presentation at Maryland Hunger Solutions legislative brainstorming session, where we had the opportunity to share with partners statewide about the innovative strategies in Montgomery County to use policy and partnerships to fight hunger. So as we all know, the nutritional content of all food is not the same. And that is true of food distributed through food assistance. And so a pound of pastries, that's not equivalent to a pound of vegetables or protein. And so while nutritional standards are intentionally implemented by a number of providers, it's not currently the case for many others. And that's due to limitations resulting from food donations, logistical barriers, and the lack of information or resources. And so our nutrition subcommittee is currently developing educational tools to increase the capacity of our food assistance providers to both attract healthier food donations as well as facilitate more nutritious food choices by their clients. And they're also exploring the creation and implementation of a nutrition standard for food assistance in the county. So the connection between sufficient access to nutritious food and the overall health of individuals and communities is well documented. And so partnerships between the Food Council, Manna Food Center, HHS, the Healthcare Initiative Foundation, Primary Care Coalition, CHEER, and healthcare providers like our local hospitals have been developing strategies to formally incorporate food insecurity screening and referral into available resources in the patient care process. Got to use my right hand, I think. There we go. So as has been shared earlier, college students are at particularly high risk of food insecurity. And as recommended in the Food Security Plan, additional research on the unique needs of this population has been a focus of efforts over the past 2 years. A number of new initiatives have been implemented by the universities of Shady Grove, Montgomery College, and other community partners to increase food access for students, including mobile markets and informational campaigns on available resources. The Food Council's other working groups, their initiatives address other recommendations of the Food Security Plan. So our MoCo Made initiative supports local farms and food and beverage producers to expand local food production and distribution. And our food literacy report is a landscape assessment of available food education opportunities with recommendations to increase resident access to nutrition, culinary skills, food safety, and agricultural training. And so as briefly shared here today, extensive collaborative community initiatives are causing significant progress to maximize the effectiveness, leverage existing resources, and apply new strategies to bring us closer to our goal of safe, sufficient, nutritious food for all in Montgomery County. And so we celebrate our successes while we also look forward to significant work ahead. And so thank you again to the council and the entire county government for making this a central priority for our community.
Good morning. I am Jackie DiCarlo, CEO of Manna Food Center. I'm also proud to be co-chair with Dr. Gales of Healthy Montgomery. I'm also a former elementary school teacher, and I'm just aware you've been asked to absorb a lot of information. Before I dig into community food rescue, do you have any questions for my colleagues? Because they threw a lot at you. I mean, I'm happy to keep plowing, but it's at your discretion.
I certainly do, but why don't we go through the whole presentation
Okay.
and we'll ask questions at the end, because otherwise I want to save time and make sure we get to your presentation, Mr. Carlo.
We've welcomed Mr. Glass and Mr. Albornoz. Glad to see Mr. Rice back, especially his leadership in the weekend bag program that was touched on. Happy to answer any updated questions on that. But I always have to give a shout out to Linda McMillan, who you newbies are learning is essential to the effective work of this committee. So I also want to commend Heather. You often hear talk in the nonprofit sector about the importance of collective impact. This is a shining example of a backbone organization who brings together lots of different stakeholders, creates shared goals and implementation strategies, and then helps us do what we need to do best at Manna Food Center, which is work to end hunger. So thank you, Heather, for all of your leadership. We at Manna are focused in a lot of the strategies that were recommended, but I've been asked to talk about community food rescue, which is a unique effort that actually the council helped create to bring together food resources, basically businesses, donors who have surplus food, keep that out of the waste stream and share it with food assistance providers making the connection through technology and powered by volunteer food runners. So we were talking earlier about the restaurant community or the catering community. We have a proud partner in Sodexo. They are a food service provider for Asbury Methodist Village, as just an example. Asbury sometimes has perfectly good, tasty food that its residents don't eat. It has established a profile in our technology. Think of it as kind of a dating app, but clean thoughts. And also established profiles from our food assistance agencies. So certainly Manna is just one among many that you saw in the food assistance directory. The algorithms match. I have 2 pans of lasagna left over with, say, Bethesda Cares that is serving a hot lunch that day. But how do we get it from point A to point B? Well, just like Lyft, our volunteer food runners get a ping on their phone, and they've been trained in health and safety standards. They have a vehicle to get from point A to point B, and that food is served. So since our inception in 2015 with council support and county support, we have served over 3 million meals that have been kept out of the waste stream and shared with our hungry neighbors. Sometimes Manna doesn't even see the food, but our role is to track that. Our role is also to, as Heather mentioned, we are focused on building capacity and collaboration. So we have created the health and safety modules for our volunteers to use, as well as our donor organizations and our recipient organizations. We have created the mini grant program, just one slight modification. This year was not the first year. We've been doing this for several years. And what these small grants do is increase capacity and say, okay, you need a refrigerated truck, or you need a freezer to keep food safe. You get this mini grant, but you get so much more because you are also now part of our network where there's technical assistance and training. And there's also the collaboration on things that have are sometimes out of the reach of our volunteer-led agencies, our faith-based organizations, who they can't be professional food security experts, but we share that information. So that is basically the concept and the theory and practice of community food rescue. We did last year release into the community $30,000 of these mini grants to 18 organizations. Community food rescue is one of a variety of strategies that you heard about. Manna is proud and honored to implement a lot of them, and so I'm happy to answer any questions about community food rescue or any of the things that we and our peers are doing to make sure that there is food for all.
Can I just add one other thing? Because Carlo touched on the prepared food, but the other piece of this also is that there's produce that may no longer be, perfect to the eyes of the grocery store, but is recovered and turned into things that then are shared later. And I think at the beginning of the food recovery effort, one of the things that at least a lot of us were so astounded at is the amount of produce that if you had a way to get it, you can pick up and distribute. But, the stories of like bags of carrots that go to a grocery store, they have the wrong label on them. The truck's ready to get rid of them. How can you pick them up? So I just wondered if you could speak a little bit about the produce part, because also the initial mini grants played into that a lot, because a lot of the organizations said, well, I could take more produce, but I don't have a refrigerator, or I don't have a freezer. So so there's a lot around recovery and use of produce, as well as sort of the restaurant caterer effort as well.
Most definitely. And in fact, I appreciate you raising it, because one of the myths is that there's a lot of restaurant food that's gone to waste. But as you gentlemen spoke earlier, there's very thin margins in the restaurant industry. Restaurants do not waste food if they can help it. They menu plan around reusing food. They share the food with the hourly workers. What we have found is really our local farmer market partners, grocery stores obviously as well. So Only Farmers Market is a great example. They have a year-round farmers market. Sometimes in the high season, Manna sends our refrigerated trucks to pick up that food because of the quantity, but when it's in the winter months or the fall months and the surplus isn't as much, we have volunteer food runners that come and put it in their SUV. But to Linda's point, they've got to, that food won't be used right away that day. I believe only is on Sundays. So having a freezer, having refrigeration that allows our smaller partners to save that food, because maybe the pantry they have or the meal that they serve is not until Thursday night, but that's still perfectly good produce, and that is one of the things that we are trying to increase because of our concern for diet-related diseases. And one of our aspirations and one of the goals of the food security plan is to get more, not only farmers and farmers markets, but grocery stores that have a clientele that are more purchasing of ethnic foods, but perhaps those grocery store chains are not familiar with the opportunity to donate food. They don't realize that their liability is covered, concerns about liability, that there are tax benefits. So part of what we're doing is also educating the business community from organizations that could get us Asian food, Latino food, and match that with our health concerns.
Wow. I knew you guys were an all-star team before that presentation, but I'm going to sleep better at night, frankly, knowing that this work is going on. I mean, as we saw, there are tens of thousands of people in our county that are 1 or 2 paychecks away from being in a personal and professional crisis. And that doesn't include the people who are already reflected in your statistics, but I so appreciate that gray area of people who are struggling on a number of different levels. And there obviously is no greater foundational issue in our lives than food and nutrition. And it is shocking when you see the numbers so stark before us, because it is a story that often goes untold and is misunderstood. I recall when I started out at the recreation department, we conducted a survey to find out what the kids wanted in after-school programs. And we were expecting to hear more dance classes, athletic programs, STEM-based education, but what we got back overwhelmingly was kids wanted a hot meal. They didn't want a snack after school. And I really credit then Councilmember Irvin and Councilmember Navarro, who led an effort working with then Dr. Jerry Wiest to initiate and enhance the summer nutrition program in the county that has grown the way that it has today. I'll also observe too that in our senior centers, as part of the nutrition program, we regularly hear from participants that that's the only meal that they are going to receive that day. And so the disproportionate impact on our more vulnerable populations is stark, and the fastest growing demographic in Montgomery County, senior citizens. And so that is an area that clearly is something we're going to have to focus on. I had 2 questions, and we've got lights on here as well. But the first question is, we have an incredible agricultural reserve here in the county, and wonderful farmers and businesses who are important members of our community. I just wanted to see if you could elaborate on how or if they're involved in this effort. I know that they are part of the group as a whole, but if you can elaborate, because Councilmember Rice and I have talked about a concept that I'll share after you respond to that question.
No, you go ahead. So thank you for that thoughtful question, because it's absolutely true that we have an abundance of capacity for growing nutritious food here in Montgomery County, and I think the demand and need for that local production is only going to grow over time. And so there's a number of ways that our local producers are supporting food security efforts, and so I think an excellent example of that is Manna's Farm to Food Bank program, and I'll allow Jackie to speak about that more in detail, but it's a fantastic way to provide an opportunity for local producers to sell their products and redirect it to residents who may have more limited access to nutritious fruits and vegetables. There's also a tax credit that was implemented at the state level last year, and so that is a tax credit for farmers that provide food donations. And so I think that's been an educational opportunity for outreach to the farmers, that it exists. And so we partnered with Community Food Rescue in December to host a gathering of over 30 farmers where a presentation was given, and we'll be doing that again in partnership with the Office of Agriculture at a meeting later this month. Because again, it's a pilot program, and so it's really important that those funds are used so that they continue. And it's currently just for the 5 southern counties and Montgomery County, but hopefully that can expand statewide. And in general, I think it's important to just emphasize that the more our farming community is supported and given access to expand their production, the more food that is grown in Montgomery County, the more all county residents will have access to purchase it and consume it and receive it through food assistance programs as well. And so the more we strengthen that sector, the more it will be distributed and shared throughout the county.
Great.
Just a quick word about Farm to Food Banks. So we have for many years worked with groups like Red Wiggler Farm, where we purchase CSAs, which we get at a subsidized rate from these farms, and then we're able to bring produce into our inventory. But regarding specifically the Ag Reserve, one of our first donors to sign up was Plow and Stars Farm out in Poolsville, because the farmers there did have surplus that they didn't want to rot in the field, but they couldn't get it anywhere else because they were busy doing the business of farming, and so we matched them with a food runner.
Thank you. The concept I alluded to earlier, and my colleague, Councilmember Rice, as chair of the Education Committee, has done a lot of work in this space, but we're interested in exploring the feasibility of more intentionally adding to the MCPS food options locally grown food, and to do something. Now, I've checked preliminarily with our Ag Reserve, and there's a capacity issue. So we would look at starting something small, possibly even with 1 day or 1 week, but that we highlight and really embrace and let our community residents know the importance of the farm-to-table concept. So that's something that we will be exploring in the upcoming year and would love to work with you guys on, acknowledging there's going to be a cost element to that, and we'll have to get creative in how we address it fully, because we want to make sure everyone is made whole. But I do think that it is something that will benefit our community at large. The other question I had for you, and you alluded to this some in your comments, but our private sector is obviously a really important partner here. We have great community-based organizations that are obviously engaged in this work, but that's sort of the choir. I was particularly impressed by Giant Foods and the partnership they have had with Manna. Had the opportunity to collect food along with my colleagues during the challenges last month. But could you talk a little bit about the partnership in particular with our supermarkets? And is there a partnership opportunity, or is there one that already exists with some of our ethnic supermarkets?
I'm going to try really hard with this great question not to get too much in the weeds, but you are right, and I should also thank you for, on that brutally cold day, collecting, as well as Mr. Glass, while Mr. Rice was in Ethiopia in the sun. And I invite you to return next year, even if there's not a shutdown. We still need to collect food in honor of Dr. King. We work on a daily basis with all of the Giant food stores in Montgomery County, rescuing food and recovering food. We have the proud partnership with Capillary Food Bank, which is part of a national organization called Feeding America. Giant, as a national organization, works primarily with Capillary Food Bank, as do other supermarket chains. That allows us to get the food rescued, as well as other purchasing opportunities. But to the point of ethnic grocery stores, this is something that through Community Food Rescue we've tried really hard. We have a part-time outreach coordinator, and Susan's job is to work with potential food donors, explain to them the benefits. But as I indicated briefly, there is some resistance on the part of some grocery stores, because after you get through the fact that no, you won't be sued, yes, you do get a tax benefit, we will pick it up, all of those things. There's still, in some communities, not the business model of we're going to throw this away instead of try to sell it until it gets so bad that it's not dignified to serve to people. We have language barriers. That's why we're so delighted that some of our mini grant recipients are from the Asian community to help us interface with those grocery store managers. because we want them to understand that it's a win-win, but it has been slower going than we would like to admit.
I think there's an opportunity for partnership and alliance there. Councilmember Rice, you have your light on. And Councilmember Glass.
Well, thank you very much, Mr. Chair. And so I want to actually go back to the beginning because I think that there's so much that we've covered. Dr. Gales, the food stat, and I would encourage anyone who hasn't been on to just play with it. I was doing some of the numbers as you were going through the presentation, and it's staggering. But one of the things it reminds me about when it comes to self-sufficiency is that we fought very hard here in Montgomery County for a $15 minimum wage. The reality is that with two parents working in a four-person household is $61,000, which is still $30,000 short of the family self-sufficiency standard. And so even with what we haven't gotten to yet, which is that target of $15 minimum wage, the reality is that still doesn't get families where they need to be when it comes to self-sufficiency. And so the reality is that while some people may be surprised by that number, I'm actually surprised that it's not higher. In reality, the only reason why it is the way it is because we have people working multiple jobs. A lot of single parents, are struggling to make ends meet. And so it really does, for us, highlight the need for us to continue to focus on a lot of our programs that we have and ensure that those continue when it comes to giving financial assistance, whether it's through SNAP, whether it's through WIC, all of those things that are going to help those families become a little bit more stable. And of course, that does, as you said, Mr. Chair, impact when it comes to education. Our achievement gap, as we know, that equity opportunity gap is shaped by the fact that children come to school hungry and go home hungry. And it's interesting. Actually, my time in, and that's why I'll dovetail, we highlight the fact of our diversity here in the county. I found out something that I had no idea before. Our Ethiopian community, the majority of them are members of our Ethiopian Orthodox Church and actually fast 180 days out of the year minimum. That means that they're vegan for those particular days, that they can't have any meat. And so having culturally sensitive food and things that are there for them and options that are there, so when you talk about the produce and fresh vegetables, those kinds of things are incredibly important to that particular cohort. And so it's something where, again, as we learn more about our cultures, the reason why Sister Cities is so important and getting an understanding and learning is that it really is important for us to make sure that we're addressing those kinds of things. And so it's a very interesting one for me, but it's one in which I also think about the availability piece that you talked about as well. It's something that we struggle with in the up county, but I know also in some of the down county areas we have that challenge as well. And it comes to, I've seen, and Dr. Gales, maybe you can help me with this, I know that DC tried to do some financial incentives when it came to grocery stores and having them locate, and even those fell through. Have we seen any successful models to where there have been urban areas, cities that have done it and been able to get those actual grocery stores to come in? Because I mean, it's much larger than that, because from a business perspective, a subsidy for 1, 2, 3 years, and after that, if it's not going to be there, isn't going to contribute to your bottom line. So I'm curious as to whether or not we've seen any success with anything like that in trying to encourage more grocery stores.
Well, I think, I'll give experience from when I lived in Chicago, my time there. The south side of Chicago struggles with food insecurity and food desert significantly. And before I left, there was a big initiative to drive, and they were pulling in Target and Walmart to relocate into those areas. And you're right, you put together an economic package, you get someone there for a couple of years, you invest in the community, and the hope is that they come, but then they'll bring others with them. And that's always a sticking point. Does that second level of transition happen? In one of the communities, it did happen where Walmart came, but after Walmart came and they built the infrastructure around, they improved the roads, they improved parking, then other, Aldi's relocated into, there are a couple of Aldi's. I like Aldi's. It's a good store. And so there was other investments in the community that helped drive that component to attract others. I am less familiar in terms of some of the larger scale. I don't know if you all have some examples of past cities, but one point I do want to bring up is the fact that it underscores the need to address it through a comprehensive kind of the health and all policies approach, where you've got everybody at the table to understand how all of the components drive getting a successful outcome. It's not just a matter of, okay, we're going to put the grocery store here and expect that to fix everything. It is the transportation piece. It's can I still, even if the grocery store is there, can I afford the items there? Are there items that are culturally competent in the sense of that fit within what I eat? And, one of the things we talk about in the medical side is when you're counseling a patient, particularly around, diabetes, you're saying, well, you need to cut this, and this out of your diet, and I need you to eat more of that. So when you're saying more of that more of that needs to be informed by what the person regularly eats, what they have access to, and understanding what they bring to the table. Because if you tell me you need to eat food X, if that's never been a part of my diet, it's not a part of my culture, I have no idea where to get it, I'm not going to eat that. And I'm probably not going to reach the weight goal or the blood pressure goal when I come back in to see the physician. And so I say that to say that it's going to take a larger scale approach to do it, consistent with the work that's been done here, looking across all of the different variables to drive the outcomes.
Yeah, thank you. I might just add that obviously the retail access, so the brick and mortar facilities, are critical in ensuring that not only that they're there, but they have affordable, nutritious food for purchase. But I think some of the most innovative strategies that we've been seeing in the region and nationally have been more focused on incorporating delivery into the services. And so for seniors, for residents with mobility restrictions, this is particularly important. And so there are some pilots related to SNAP being used for online retail as well as delivery models. And so Baltimore Market is a model in Baltimore that's been particularly interesting. And I think there are ways that we can explore implementing some approaches like that here in Montgomery County that will help those that, even if the store is within a mile of their home, the reality of getting there and buying a cart full of groceries and bringing them home and getting them put away is important. And also having more accessible prepared foods. So not just delivery, but when they come to you, it's something that you can cook and you can prepare and actually turn into a meal at home.
Yeah, I just want to follow up on that, because I think that, again, when it comes to the transportation piece, something that we continue to struggle with here in the county, especially when it comes to our up county and eastern county, to where the routes aren't as regular and as frequent, and become tremendous challenges. I mean, to get around Germantown easily can take you 45 minutes to an hour, and that's just in Germantown. So going grocery shopping is a long time ordeal. And then, just as you said, then you're traveling on a bus with, 10 shopping bags, and it creates a challenge. I want to give kudos to Manna, and Jackie knows where I'm going with this because it's incredibly important, with Manny, and really going out. But it's even more than just the bus itself, but really starting to set up hubs within the various communities to make it easier, because it's great to have one central location, but the reality is, as we all know, it's hard to get to that one central location and takes a long time. And when are you going to do that when you're, by the way, working those two jobs to try and make ends meet? And so it really is one, bringing that to the community is so, so important. So thank you for participating in the Germantown Hub. Thank you for what you're doing and continuing to expand, because those are the kinds of things that will continue to make the difference and bring that to the constituents instead of them having to try and figure it out. It's one in which I think that, again, we're going to have to be very forthright in terms of our thinking when it comes to our regional services centers and how those can continue to work for us on so many levels. We've done it when it comes to access and signing up for things, but actually to have deliverables there is something that I think is the next step for us. My hope is that, it's similar, and it got me thinking with one of the folks here in the office who has they have the CSA that comes and delivers food here to the council. And then everybody, you know, who's a part and participant picks up. Why couldn't we do something like that with food at our regional services centers, so they could go to those regional service centers or to our libraries and pick up the food there, so we could actually have it there, similar to what we do with our weekend backpack program for our kids at our schools. And so it's just thinking outside the box, and I just think that there are ways in which, from that delivery model, while I think that, you know, the Amazon deliveries and, you know, Uber and all those kinds of things of the world, and hopefully we'll get to the SNAP and be able to do that collaboration that's there. I think the other part of it also is making this convenient for folks. You know, I've got to go to the library anyway to get my kids, you know, it's got to do a project, and I don't have a computer at home, and so I'm using that computer, and oh, by the way, at the same time, I can pick up my food order. And so, you know, it's from that perspective that I think that there are more ways in which we can collaborate and expand and bring things to the community. But you guys are doing a phenomenal job. I thank you for your dedication. I thank you for continuing to figure out ways in which we can meet folks where they are, and for being culturally relevant. I think that there's some other next steps that we have in that realm too, in which we can continue to do and diversify. But I think we're on a great track. So thanks for your work.
Councilmember Glass.
So picking up on my colleagues' plaudits to you, one more, thank you for everything that you've done, especially over the last month, 6 weeks. And unfortunately, the specter is not going away. Hopefully, we don't have to call you back up to do even more, but you've done a tremendous job, and know that you'll be ready. And in Mana's case, you are maintaining your levels of service with the future to be told. So thank you for all of that. I was reading through the packet and your reports, and lots of really good information. I just want to drill down on a few pieces. It was enlightening, that's not the right word, but 6.5% of seniors, nearly 9,000, living in poverty, with an additional 5.4 living between 100 and 150% of the poverty line. So essentially what we're talking about here in Montgomery County is, if we were to put them back in school, about 12% of the senior population is eligible for farms. And so stressing the need even further. And why we have the program like the cold box lunch program, which was new to me before reading about it. And so really important given the statistics that are outlined. And I'm curious, it says that there are 16 buildings or 16 facilities that participate in that program. Do either of you, do any of you know what those specifics are, or how communities become partnerships with that program?
I can get you the information for it.
Okay. Yeah.
We can get you a list of the senior buildings. I would just say that one of the interesting things is, and this gets to the other issue, so the cold box lunch program actually started, there was a small grant, and it was a pilot program, and it was going to go away. And then people said, this can't go away, actually, like, we need it more, right? So we have expanded it, but one year we expanded it to a building that actually had a lot of folks who wanted a certain type of ethnic food, and they actually didn't want the cold box lunch program that we were providing. And so these are the kinds of issues that, as we talk about like culturally appropriate food, as we reach out into the senior buildings, many times in some of the senior buildings, there are, a significant population that are used to a certain kind of ethnic food, and that's actually what they desire. So that was our first time of like trying to expand it and having somebody say, no, thank you. It turned out like we didn't want it. But clearly it's not because those seniors weren't interested in having additional food, but they were not eating what was provided in that box. And then the other thing I just would say, the buildings that will be on the list, you'll see actually are generally senior buildings, right? But we've also had discussions that we have a lot of naturally occurring, retirement communities, a lot of buildings that have a high concentration of seniors in them, but they're not senior buildings. And so in the past, several of those have been identified as specific places where there might be a role for outreach or additional things like the cold box lunch program.
It's fascinating that you talked about the cultural sensitivity related to that program, because within the mini grants, I saw that there's a Jewish organization and a Chinese organization, and as Councilmember Rice, talked about the Ethiopian community, absolutely. So looking at those cultural sensitivities and how we can all work together is a whole nother aspect of moving forward, but one clearly within our diverse community we'll need to tackle. And that also goes to my next question regarding the cultural sensitivities. Are these materials produced in various languages, Amharic or Chinese or any other languages that might, we have a lot of languages that are spoken here, so I'll let you answer that.
When it comes to food safety information through Community Food Rescue, we have translated those into 6 different languages. Most of our materials, day in and day out, are related in both English and Spanish. We try to recruit volunteers in our participant services team who take orders and who schedule people who have a variety of backgrounds linguistically. If I could just piggyback, though, on the last question, I wanted to point out that some of the folks that are naturally occurring, we talk about our senior population, many folks wanting to age in place. I know I do. But unfortunately, a lot of people are aging into poverty. And so one of the things that we have piloted at MANA is to work with the Villages movement. So Pazit and the Office of Community Partnerships has been a great champion. So we piloted at the holidays, just a handful of people, but we identified folks who are living in their own homes and seniors over 80. And so, for instance, one of our participants, 92-year-old Margaret, lives in Bethesda. Wingate Hills, Villages volunteers came and got her food and brought it to her home. So the mobility question. So we are trying to continue to innovate around that. But linguistically and culturally, one of the things that we hope to do as we are in the East County, and this is a good opportunity for me to thank Mr. Rice and the previous council for investing in our East County Center, which will be opening in May. And that we hope to have more volunteers from diverse communities in East County to help us with a culturally appropriate shopping experience, because people will be able to choose what is right for them, for their health, for their background, for their religion. It's a much more dignified opportunity, and it will draw the community and help us with linguistic capacity.
I appreciate you mentioning the villages, because I'm going to be going to actually a coalition of villages in the Bethesda, Friendship Heights area. Some of those communities are naturally occurring senior communities as well, and so I'll certainly relay that information to them. The other aspect of the conversation that I'm intrigued about are the volunteer food runners and the 3 million meals that they've helped provide. How does one become a volunteer there? I'd love to help publicize that more. Good question.
CommunityFoodRescue.org is our website, and it's very easy to follow the steps into. You do have to study up for a food safety test. It's online. We have videos available. We used to do in-person trainings early in, and we found, back to Mr. Rice's point about convenience, people would rather take the classes off of YouTube. So we have these modules, you watch the modules, you take the test, and then you get a profile on this technology, which is called Chow Match. So we'd welcome you generating interest in the community food runners, because we have used them in this great sense of civic engagement, not just to get food from point A to point B as part of our regular course, but during the shutdown social, where there were 24 restaurants who donated food. We had our food runners pick up from those restaurants, get it to Blair High School, and then when there was leftover food, the food runners then took it to MCCH for one of their shelters. So we're trying to figure out how to leverage those food runners and keep them busy.
Chow Match.
Chow Chow Match is the name. We worked with a nonprofit in Marin County in California called Peninsula Food Runners, and they created this app. And thanks to county money, but also private foundations, we've been able to invest in it and make it more sophisticated so that it is now a mobile technology on phones.
Very cool. Yeah. Sounds like one of the best named online matchmaking sites. And the last thing I want to say is that in the recommendations also talked about the importance of public transportation, which you've alluded to, and Councilmember Rice has alluded to as well. And so as we move forward with implementing those recommendations, thinking how our ride-on services and the research that would go into this, making sure that we communicate with some of those senior apartments and other areas to make sure that to do a proper analysis on our public transportation system and how it is or might do a better job incorporating some of the culturally competent grocery stores and food pantries and others. Since it sounds like I know that our public transportation system, particularly Ride-On, is not just a feeder system for the Metro and for Metrobus, and making sure that the routes do provide access to the real needs and services that our residents want. So making sure that we'll follow up with that. So thank you for all the good work you do.
Great. Just two closing comments as we wrap up. There's one more item on the agenda in our session today. Our faith-based community obviously plays a really important role in their space. A number of them have their own food pantries that I'm personally aware of, and I know they're partners in this effort. I think that we, particularly within our ethnic communities, they can be a bridge and a link, and can also help us connect to those international food markets more cohesively. And so I know Reverend Caseman is very involved in this effort, and I would like to just, however we can be helpful in making those connections, because I think that will be another really important conduit to get us where we need to be. And then you read my mind in terms of the villages. And I think a broader point is taking advantage of the existing infrastructure in other spaces that do really great work. And I think that's one of the most exciting parts of my job as a council member, is having a broader picture. And so I will be making lots of connections and referrals, as I know my colleagues have been doing so successfully for so long. But that's something I want to be more intentional about, and look forward to working with you guys on that. So I guess my final comment is just a question. So we've got the recommendations, but if you could wave your magic wand beyond millions of dollars falling from the sky and eliminating poverty, are there some policies that are getting in your way? Is there some connection to the state? There's a lot out of the county's control, but you got a magic wand here. What would you do? What would you look for us for help with that could make your jobs a little bit easier?
How about I answer and let you have the last word? I want to let you know it's not magic. We're actually involved in some rigorous advocacy as part of our own strategic plan. MANA has formed an advocacy task force. On it includes our peers, but also people with lived experience of food insecurity. And one of the things we're right now pushing hard at the state level for is something called Summer SNAP. And this is an initiative where MCPS is doing a great job with its food sites during the summer, but for a variety of reasons, whether it be transportation or other concerns, only 16% of the kids who are eligible for those meals are getting them during the summer. Summer SNAP has been piloted nationally, and what it does is it loads onto the parent's EBT card the benefits that would accrue at the cost of the meals at the summer sites. So we are urging for the first year $2 million to reach 20,000 kids students around the state. And MCPS has tentatively expressed support for that idea, and that's a way to use technology at the summertime. So that's just one of the things but we are definitely in Annapolis. We're also part of something called the Food Research and Action Center, which looks at national programs, and certainly the Food Council has a policy committee, so I'll let you have the last word.
So absolutely, we're involved in a number of initiatives at the state level and serve as a communication pathway for all of our partners in terms of weighing in on those policies because they do directly impact Montgomery County residents. What I would note policy-wise is that we're in a current state of trying to increase participation in benefits program while also in a greater context of there are tremendous changes in coming down the road potentially, or even the possibility of those changes that are impacting residents' interest in participating in those programs. And so that ranges from participation in SNAP to even participating in free and reduced rate meals. And so I think there needs to be a general acceptance of knowing that the county needs to be versatile and willing to adapt to these the change in climate that may require a massive redirect. And so having the county as a partner in this work and openness to continuing these conversations as things progress, I think is really important. The only other thing that I would note is it's spelled out in the food security plan, but the food system stakeholder community is very interconnected and very strong in this work, but it's going to take the engagement of all sectors in order to really achieve these goals. And so even when we talk about private sector engagement, it's going to require involvement of moving companies and storage companies and others with infrastructure that can support in this work as well. And so I think where there can be an eye toward that in policy making and in building bridges throughout the county for this work, I think the county's partnership in that will be really valuable too.
Well, thank you very much for the presentation. This was an informative conversation, one we will keep having, and keep up the great work and let us know how we can help. Thanks. All right, let's move on to the last item on our agenda. Dr. Gales is going to give us a briefing from the Health and County and Zip Code Ranking Project, which I read with great intent a couple of months ago and was alarmed by. And I just want to thank you, Dr. Gales, for your thoughtful work in this space, and turn the mic over to you.
Sure. Well, thank you again for the opportunity, and just to give further kudos to the food security team, plan, and committee. They're doing great work, and very thankful for the opportunity to partner with them. And to that end, one of the things, I don't know if I can answer that last question, because I'm told I should never come asking for things. But what I would say that from a philosophical standpoint, I think it underscores the need to think through health outcomes when thinking through all these other policies. And what we're trying to do on our end is to come up with quantifiable metrics to measure the impact on health when different policies come up, particularly in areas where you don't traditionally think of related to health. So when you're talking about transportation policies, how can we come up with a measure to say when you have Route X, what impact would that have on a diabetes rate or heart disease mortality and things like that? So that is what we're trying to continue to do in the public health sector, is come up with some innovative data-driven approaches to address health outcomes. And I know that we had, and unfortunately the meeting is at the same time of you all standing meeting. We had extended an invitation to participate in the Health in All Policies Forum, where we are pulling together the senior leaders from across the government agencies to start and initiate that conversation and talk about how we move forward with that. And so I know you won't be able to make the first meeting, but looking forward to engaging you all on that as we move forward. So in the interest of time, I will go through this really quickly and say that the reports are available online to council as well as the audience, but want to highlight some larger points of really what we're trying to do in terms of using the data to drive and get our interventions more tailored to our communities. So we'll skip through here. And the dash is an example of a grant that we received, and this may seem redundant to Councilmember Rice. He's heard some of this before. It's an example of what we're trying to do. We don't want to rely solely on local and state funding as we approach health issues, because we know that's subject to budget cuts, federal furloughs, the whole nine. So we want to diversify our funding portfolio, and we recognize that part of that is creating the infrastructure to be looked at as attractive for those opportunities. So to that end, last year we spent a lot of time shoring up our data infrastructure. We do have the formal partnership with the University of Maryland School of Public Health in place. We are working with George Washington School of Public Health to have a similar partnership in place over the next year, and looking to extend our partnerships with agencies within the county. For example, the National Institutes of Health is physically located in the county, and so we've had some conversations with the National Institutes of Minority Health and Health Disparities, as well as the Office of Research on Women's Health. Those are just two examples, as well as we have done some work with the FDA around opioid overdoses. And so looking to shore up those partnerships to be able to help expand our capacity to do the work that we need to do. So this is just an example of a grant that we received from Robert Wood Johnson to help build our data infrastructure. We looked at it as it was a small grant, but an opportunity to impress them with our efforts and hopefully lead to some bigger things. Now, part of that grant helped support our data-driven approach. We're calling it D2P, Data to Prevention, Promotion, Policy, Practice, and Planning. And overall, that is basically looking at how we can use data in these particular areas. Prevention, for example, the annual health report that was put out last year. And I do have an update on that. So what we've decided to do is, since it's such a large undertaking, is to come up with the larger status of health report every other year, but in the off year actually focus on some highlighted areas that we know are of importance. So last year we had the pretty significant status of health report that chronicled health outcomes over the last 6 years within the county. This year we're going to highlight, well, we've already put out a couple of reports. We put out the infectious disease report, if you recall, highlighted the rise of STIs in our community and reminded folks of the higher burden of tuberculosis within the county. And for example, that data has been helpful in driving conversations at the state level to receive increased funding to address the rise in tuberculosis cases that is happening in the setting of significant cuts from the federal level. And we haven't received word on what that looks like yet, but I'll keep you posted. I was promised that there would be some good-looking budget opportunities to help support that. We are going to be putting out a report around maternal and infant health, because we found last year, as you may be aware of, again, there is a significant conversation within the country about the fact that Black women in particular are dying at significantly higher rates in childbirth comparison to their peers. We looked at that in our county and we did not see a high number of deaths, but what we did find in our analysis is significant morbidity. So, for example, Black women in Montgomery County, again, we don't have a high number of maternal deaths, but Black women in the county are 40 times more likely to have severely complicated pregnancies, and Latina women are 20 times more likely to have severely complicated pregnancies. So we are going to be releasing a report probably within the next week or 2 weeks that highlights where we are on that and raises awareness. We're going to be and the plan for the rest of the year is to do a report on chronic disease, particularly diabetes, because the state, the Secretary of Health has identified that as one of his priorities over the next year, is to drive down the cost of care related to diabetes, as well as one on a profile of the uninsured, who they are in our county and what are their needs. And then, so again, those are, the goal is to use data to address emerging issues. And another one where we've convened a task force is around vaping and e-cigarette use. And again, that's another area that we're hoping to be able to respond to. So the D2P approach, again, quickly just highlights these different areas. Promotion, doing a lot of work with maternal and infant health. And again, I know I'm going through these quickly. If at any point you would like to have a further conversation, we'd be happy to engage the staff with you to talk about those in more detail. Again, the data report we talked about, this is the status of health report. It's actually over 8 years of information. The next one will come out in this winter and spring of next year. And then one of the reports that does come out on an annual level that was the driver for the zip code analysis was the Robert O. Johnson Healthy County Report. It comes out every year. we do really well every year. And hopefully as long as I'm here that we do really well, because if we fall, then maybe I won't be here much longer. But the purpose of these reports is to rank the counties across the country in terms of health outcomes. There is an algorithm, and here is all of the counties in Maryland. We finished #1 last year and have been #1 overall the last several years. And it just shows you how the different counties stack up against each other. And here's the algorithm of the different factors that were used in that analysis. But one of the things that I continue to be alarmed about, and one of the things we've been working on, is the fact that if we only look at the overall numbers, we're always going to be doing fairly well, at least for the next 5 or 6 years. And what we have decided to do is to say we are no longer going to use the state and national averages as our benchmarks, because if we do, again, we're probably going to do well and perform better. So our team, Dr. Chun-Fu Liu is our chief epidemiologist. He and his team are working on creating county-specific measures so that when we come and give reports and updates to you and put out reports to the community, we're going to judge ourselves based upon those to show if we're actually trending in the right direction. Again, not to just say, well, we beat the state this year again. Okay, great, but what do our numbers actually look like? Do the programs we have in place actually have an impact on improving health in the county? And so one of the efforts that started that was doing a zip code analysis to say, yes, the overall numbers look great for the county, but when you break that apart, are there areas that are of significant need? And the short answer is yes, there are, across all of the different health outcomes. So fortunately for us, some researchers at the University of Wisconsin and University of Michigan created a modified algorithm, of the Robert Wood Johnson algorithm, that actually took in more local specific data inputs to be able to show the variability within more local jurisdictions. They did this analysis on the state of Missouri, where they took all of the counties within Missouri and ranked them next to each other. And what we did was we pulled it and ranked all the zip codes within the area. And so the subdomains are length of life, quality of life, health behaviors, clinical care, socioeconomic factors, and physical environment. And I will say some of these, if we're to do this analysis again, we would tweak them and make them more specific to Montgomery County, particularly the issue of physical environment. We don't have a lot of violent crime here in comparison to other jurisdictions. And so potentially in the next iteration of this analysis, we may consider adding some other variables to that to approximate it better for Montgomery County. And to just demonstrate the model accuracy, the Pearson coefficient is fairly strong, 0.983, in terms of the modified algorithm measuring outcomes in comparison to the original Robert Wood Johnson algorithm that they used. So just to go through very quickly, the subdomain scores. Length of life is the first one. The two components of length of life are age-adjusted mortality and years of productive life lost. In the whole state of Maryland, we rank #2 in terms of life expectancy. And again, our county average for years of productive life loss is 3,500 versus 6,500 at the state level. So again, we perform very well. But when you break down length of life expectancy, it's highly variable within the county. There is our zip codes located towards the district on the southern end that have life expectancy. I think there's one zip code in the Potomac area, life expectancy is over 90. And the life expectancy, I believe, in Poolesville was 75, 76. So even within our county, there's a 15-year difference dependent upon zip codes. When you're breaking down the analysis, the zip codes that are in blue represent the top 25%, the top quartile, followed by the lime green, then the golden yellow, and then the red. The zip codes in the red represent the bottom performing quartile. When we look at years of productive life loss, again, that correlates to life expectancy. The measure is using 75 as life expectancy, and years of productive life loss means so how many folks are dying before the age of 75, and based upon when they die and the difference between 75, how many of those years add up cumulatively. And so overall, when we look at length of life, combining the two subdomains, here is how the zip codes break down. And our top 5 zip codes, as you can see here, they're broken down by top 5 and our bottom 5 zip codes for length of life collectively. Quality of life, in comparison to the rest of the state, we rank number 2 by the Robert Wood Johnson algorithm. The components are inpatient and emergency room hospitalization rate, mental health related hospitalization rates, and low birth weight deliveries. When looking at hospitalizations, again, the blue areas in blue are our higher performing quartile. When looking at percent of live births with low birth weight, meaning those who are less than 2,500 grams. What's interesting with this is I want to highlight is historically Montgomery County has not been seen as a high risk, high need area for maternal and infant health, thereby not being eligible for a significant amount of state funding. That changed last year due to 2 things. One, the state recognized that yes, there are pockets of need, and then we were able to use data to show, for example, zip code over here, zip code here, and in this area that actually have higher infant mortality rates than the state average. And so as a result, we have been deemed eligible for more funding, and we received a grant from the Babies Born Healthy funding mechanism it's a grant of for 5 years over $450,000 per year to be able to invest. And what we're targeting are these zip codes that you see in red to do a deeper dive, to get increased linkage to support services to pregnant women in those areas, to explore some best practices, and then hopefully after year 2, be able to scale those up to the rest of the county to be able to see and determine impact. Look at hospitalizations for mental health conditions. Again, this is how things break down. And when we quantify those all together, looking at quality of life, here is how the county breaks down. Again, you see the higher performing quartiles in blue, and the red zip codes represent the lower performing quartiles. And again, when you break them up in top 5 and bottom 5, here's where we stand. Next measure, health behaviors. Health behaviors in our modified algorithm, we actually finished number 1 in the state per Robert Wood Johnson. And then when looking at the components for this, we're looking at teen birth weight and sexually transmitted infection rate. And again, you may have heard STIs are on the rise in our community. Teen birth weight, not so much, but STIs certainly, particularly gonorrhea and chlamydia. When we look at STIs per 100,000 persons, again, you can see how this breaks down within the county. And I do want to highlight again that the STIs, chlamydia in particular, and gonorrhea are hitting 15 to 24-year-olds. Chlamydia significantly impacting the 15 to 19-year-olds. And I want to give kudos to the HHS subcommittee from before and the larger council in supporting our efforts to increase access to contraception in schools and to help support our larger efforts to address the need within the community. And then this shows our birth to teen mothers. Again, we don't have it's not a significantly high rate in the county. Slight uptick in young Latino women, however, around this particular issue. And then when we combine this, this is how the county stacks up. The zip codes for that. And here are our top 5 and our bottom 5 zip codes. Clinical care factors, looking at here are the components. This is our overall ranking in the state. After hours hospital visits, and one would say, well, how are after hours hospital visits a measure of clinical quality? This gets to how many people have access to primary care, how many people are showing up to emergency rooms after hours for conditions that could have been preventable had they had a medical home. And then also gets to the concept of chronic disease management. Are folks, due to their inability to effectively manage their chronic disease, are showing up to emergency rooms due to complications because of that inability? And here is the collective number here for clinical care factors. And our top 5 zip codes and our bottom 5 zip codes. Socioeconomic factors, number 4 in the state, but it's measuring all of these different components here. again, one of the things we don't have, we look fairly good when it comes to socioeconomic factors, but one of the things that this does not measure that goes back to the food security conversation is the fact that we have people working and we have a high median income, but the reality is a lot of folks don't hit the self-sufficiency standards and so are falling within that donut. So make too much money for benefits, but not enough money to really sustain a healthy lifestyle. So just collectively putting these all together, here is how the zip codes stack up against each other. Our top 5 socioeconomic factor county or zip codes are here, and here are our bottom 5 zip codes. Physical environment, again, this is one that I would tweak further given our low violent crime rate in the county. Here's age-adjusted mortality for deaths due to injury and hospitalizations due to violent injury. Again, we don't have a significantly high number compared to other jurisdictions. When we sum those together, here is how the zip codes stack up. Here are our top 5 and our bottom 5 zip codes related to physical environment. Now, we put them all together. Remember, there's the health factors and then the life expectancy components. When we put all of the health factor domains together, which is health behaviors, clinical care, socioeconomic factors, and physical environment, here is how the zip codes look. And our top 5 zip codes related to health factors and our bottom 5. The top 5 are in blue, the bottom 5 are in red. And when we put all of these together, the health factors with length of life and quality of life, here is how the zip codes look next to one another. And here are the overall rank. And so we did actually tweak these a little bit. So in the analysis that is on the website, there's only 36 zip codes. So what we did do is we went back and took out zip codes that either spanned across county or there was insufficient number for some of them. For example, around the ag reserve, there weren't high population. And in that particular one, Poolsville did come out as the lowest, number 36. So that's why there's a difference between the one that is posted on the website and the one that I'm presenting today in terms of overall ranking. So that concludes the zip code portion. Be happy to take any questions. Like I said, I went through this really quickly in the interest of time. We do have a lot of data. And I will say that I'm looking forward to working with you all to be able to, particularly if there are initiatives or issues of great concern to you, to be able to quickly and provide comprehensive, thorough data to you to help drive those conversations.
Thank you, Dr. Gales. We could talk about this all day. Let's try to wrap up in about 15 minutes or so, and there will, I'm sure, be follow-up after this. But I can't thank you enough for this work. I remember when first reading this in the Washington Post, it's alarming to see that your life expectancy can be so derided by what zip code you live in. And we are a microcosm of our entire country, where we have suburban, urban, and rural communities. I visited Poolsville 2 weeks ago to talk to their town commission, and when you talk about healthcare access, they literally have a healthcare access issue. There's very little infrastructure in place within their community, and when there's inclement weather, there are very few private providers there, no public providers, and so it's not a huge surprise to see some of the outcomes because of the rural nature of health and its impact in those communities. And same can be said for communities where we have higher concentrations of violence and where we have higher concentrations of criminal activity. So it is sobering, to say the least. I just have one question, and then we'll defer to my colleagues as follow-ups, and I'll have more later. But you mentioned wanting to identify third-party funding sources, and obviously the county traditionally does not fare well in securing those funding sources. For all the reasons we know, there continues to be this impression that we don't have the need that we have here. Have you identified specific foundations that you'd like to target? And if so, can we help you collectively form a coalition to aggressively go after those funders in this upcoming year, armed with this remarkable data and other data points that we've identified?
Sure, we have. I mean, there's an extensive level. There's public and private foundations to support the work that we're doing. And so there's two things we did last year that are continuing this year to help, again, to set the stage for what you're talking about. So the short answer to your question is yes, we can, and we can discuss how we may be able to work together to pursue these funding opportunities. But there are a couple mechanisms we did. So one, the academic partnerships are key because there are also funding opportunities that, for example, faculty members have access to. For example, a lot of the NIH funding mechanisms, the T grants, the U grants, the R01s, the R24s, all those funding mechanisms, faculty members can apply for to cover their research. Well, if a faculty member has a particular research interest that matches up nicely with a particular issue within our county, because what we found is lots of researchers, particularly in this area, go to Prince George's County or to DC or to Baltimore and haven't historically looked at Montgomery County as a place to do the kind of work that they're doing. And so that's one mechanism, increasing that academic component to be able to increase access to those funding opportunities. So even if it may not be us who is the direct recipient of the funding mechanism, you know, faculty member X is researching an issue that's a pressing issue for us, will help us identify best practices and address an issue here through the funding that they receive.
And then do you have capacity within your office to go after those grants?
And that's the second component. So we don't, particularly around, we're working to grow our epidemiology department. Right now, you know, we have 2 EPIs to do a lot of the work that we're talking about, and they're doing an excellent job. But, you know, we're trying to figure out how to modernize that infrastructure. And again, one of the benefits of forming those academic partnerships is to be able to create a pipeline of faculty members of interest in the project. So, for example, the zip code analysis, Dr. Castro, who's at the University of Maryland in their School of Public Health, we were talking in our early meetings, we're talking about some of the analysis we were hoping to do, was excited about it and helped us complete that and help drive that conversation, as well as a pipeline of very talented, smart graduate students as well who can help us with that. And so we have created a pipeline and opportunities for those students to come over, and we have right now, I think there are at least 4 or 5 students from the University of Maryland who are working on just within the epidemiology program and the Healthy Montgomery program to be able to provide that support. Certainly a goal would be to be able to, you know, build an internal army of staff to be able to do that. But in the meantime, you know, we're trying to diversify the ways we achieve that.
And I just want to go on the record, I think that exploring this further and looking at a team of folks that we might even subcontract with to help identify additional resources that are out there and then manage those, I know sometimes very complex contracts, would be a wise investment of the county because it would bring us resources that we otherwise wouldn't be able to secure on our own. So do my colleagues have any questions or comments?
Thank you for that.
Councilmember Glass?
Sure. Thank you, Mr. Chairman, and thank you, Doctor, for walking us through this. Illuminating information, and I know I'm definitely going to follow up with you on a lot of different aspects, but for right now, I just have one question for you, and it's regarding the information related to behavioral health. And the data show that mental health-related visits to the emergency room is on the rise, both generally and also related to suicide. And curious to know if you have any underlying reasons or if there's anything else that can help provide a narrative as to why that might be.
Well, I think right now, most of the energy around behavioral health is focused on opioid overdoses, rightfully so. There's a significant need. But we are missing an opportunity to have a larger conversation about behavioral health needs in general. I think that, you know, when you pull the Band-Aid off, yes, there are overdoses that are happening in the community. There are a lot. There is a lot of drug dependence. But there's also there's a huge shortage of beds, inpatient, outpatient programs. Right now, let me give it wrong, the county does an excellent job, high-performing behavioral health program, but are hamstrung by the limited resources available. The time getting people connected to care that they need still remains a significant issue. And so I think all of those factors contribute to, utilization of other spaces for behavioral health care. That does also present an opportunity to do some creative, innovative things around increasing access to care. So, for example, we have been looking at, using the data to drive this conversation, we have been looking at using our school health and wellness centers within the high schools to provide after-hours care of some sort. And what we did is we looked at the four high school health and wellness centers throughout the county and looked at what are the emerging pressing issues in those particular catchment areas. And we found that, for example, in Gaithersburg High School in the catchment area, behavioral health is a significant concern. So we said, well, how about looking at and exploring how we may be able to use that space to provide behavioral health services. So does that look like having contracting out to a counselor coming in after hours to do, outpatient therapy? We're still working out those details. But again, it's an example of data helping inform a process, highlighting a need, and then helping inform the process to be able to use some non-traditional resources to address it.
Well, all the data is here, and we just have to harness it all and enter into some of those partnerships that have been alluded to make others realize that the need is here as well. So I look forward to following up and digging a little further into this data. Thank you.
Councilmember Rice.
Just very briefly, and Dr. Gales, when you first gave this presentation to us, I know that we were stunned. I've had a chance to recover from that, seeing that a large portion of my district is incorporated in, including Montgomery Village. I see Dave Humpton here from Montgomery Village Board of Directors. And let me just say that I think that part of it that you've highlighted, and we talked about this when it came to food insecurity, is also health insecurity when it comes to access. Although we do have a hospital in Germantown, and that's where oftentimes people go to get their primary care, the reality is that not having a large number of primary care physicians in the Montgomery Village area, as well as in areas in the East County, whether it's Wheaton, Silver Spring, and Poolesville, are certainly indicative of what we see when it comes to some of those health conditions. And so the same question that I had asked before about ways in which we can, as I've talked with, especially the folks in Poolesville, who've had a number of providers there pull out in recent years and don't have anyone really representing that area any longer. Have there been instances that you've seen, situations in which a government has been able to incentivize folks to come into those areas, understanding that we are not in the practice of providing health care as government? And so, having a, health clinic or something like that really isn't feasible from a county government perspective, but how are other areas able to grapple with these kind of challenges, seeing those highlighted red areas that continue to plague us?
Sure. So it's interesting that you mentioned that because we are wrestling with that issue within the Montgomery Cares program, for example. I know you've received some communication about different aspects of the program, and we are looking at it as an opportunity to figure out, well, how could we potentially even grow that program and make it more innovative? We have been working with a researcher from University of Maryland, Dr. Dylan Roby, who's an expert in services for the uninsured, and studying other jurisdictions to look at how they grew their programs to address issues for people who were kind of falling within the cracks. A couple of examples are Los Angeles and San Francisco. We've initiated some conversations to study what their models look like. Chicago is doing some interesting things, and in fact, I'm going to go to Chicago this afternoon. Thankfully, the polar vortex has gone, and that's last week. Right, it's, well, I lived there for years, so it's all about dressing in layers. But going to spend some time with their health department, and this is one of the areas that we're going to talk about in terms of what's their safety net services. Because you're right, the government can't be the provider per se, but how do you create one, if you are in the business of providing support and funding for a health program, how do you create options that address all of the different care needs of the patients to then potentially partner with the healthcare providers within the community cover. So for example, San Francisco's program is, I call it Montgomery Cares on steroids ×2. So you get they have a membership program where there is a hospital benefit. There is a specialist benefit component to it, which things that we don't currently have at ours. But over the years, they've been able to study to figure out how do you address the needs of those patients and clients. So then there is an opportunity for folks to receive enhanced primary care so that when they do actually present to the hospital, they're not coming in, they're coming in better managed. And are creating less of a financial drain on the hospitals because the level of care and the acuity of care they need isn't as significant as if they had been coming in completely uninsured and not connected to something. So yes, there are some innovative models out there. We are actively looking at them to see how we could build in some of those benefits within our programs. And then also create a better marketplace, I think, for that conversation to figure out how to, if you have an area like Poolsville, what would make it attractive for a larger provider to, set up shop there? Would it make sense for Hospital X to put a satellite clinic there, or would it make sense for an extension of one of the Montgomery Cares programs to be there? So those are the kinds of things that we're hoping by creating better, more sustainable models, particularly the ones that we fund and have an active role in, that can drive the conversation a little bit more and make it more attractive for those opportunities to happen.
In some of the questions you raised, it's one conversation when you're talking about the safety net that would be provided through potentially through county government program. But particularly like in behavioral health, people may have private insurance, but they cannot find a provider, right? And so, right, so and I think in some of the geographic locations that we have also, people may have some kind of coverage. They may have Medicare, they may have private insurance, but there's not enough market for it to be located very close to them. So it's not as important, obviously, as the safety net discussion is. When you look at the whole population health, you're also talking about access for people who have coverage through other means, right? So it's different conversation then, right? Yeah.
Thank you, Dr. Gales. This was a really important presentation, and look forward to an ongoing conversation. Data-driven work is so critically important, and so we've got a strong foundation to build off of, and we look forward to working with you in the future. Thanks. And that adjourns this particular HHS committee session. Thank you.